Hi there, Sabine here with some thoughts for the day. I want to talk a little bit about spirituality today, especially spirituality in psychotherapy. There is a long-standing tradition in psychotherapy and in the different schools of psychotherapy to really want to be seen as something that is evidence-based and scientific. And there's a whole long discussion in there about what is actual scientific and what is actually evidence-based and so forth. And I'm not going to go there today, don't have the time for that. And there are also very good reasons for any profession in the medical field to want to be very scientific, because we want to make sure that our clients are taken care of, and we also want to be taken serious with the work that we do. But nonetheless, we are actually, as human beings, so much more than the physical body walking around. And for most people that come through our practices, spirituality in some shape or form is a part of their life, even if it is just, I don't believe in anything, but my spouse does. So there's always that undercurrent that is there, and we need to work with it. So to come back to the question of how and why do I integrate it, first of all, the why, I don't actually see it as a risk. I see it as something that is necessary, that is part of the human being and the human lifestyle, right, Lenny? And it is also an important part of me and my life. So to exclude that completely from the work would actually be more risky for me than to actually integrate it. The how is a different question, and I think that is often the one that is more difficult to do for people, because the how is about the other person, it isn't about me. It isn't about particular tools, it isn't about prayer and meditation, channeling or anything like that. It isn't about energy work. A session that is just pure talk therapy, even a CBT session, can be deeply spiritual if we make it about the connection to the other person. And I think, to me, that is probably the most important part, that spirituality in a psychotherapy session isn't about what is done on the outside as much as it is about what is the intention for the work. In this movie, Dangerous Method, Jung is saying that he wants to do therapy that does more than just show the patient where the sickness lies and how ill they are. He wants to show them a way forward to become the best person they can be, or I think he actually says to become who they were meant to be. And to me, that is the part that is the spiritual aspect of psychotherapy. So how do I include it in my work? I include it by holding that image of the best a person can be, of the thing that, the person that they were supposed to be. And I try to work towards that with the means and the tools that the client is comfortable with. So, if you're a practitioner, if you're a psychotherapist out there, consider what the spiritual aspect of your clients may be and why they may need some inclusion of that in your work, even outwardly, but also consider inwardly who you are and how you practice, and don't dismiss that, and don't be too shy to put it out there, because in the end, there's still a lot of people out there to whom spirituality in some shape or form is really, really important. And why would you leave something that important out the door when you come to do your inner work? Anyways, that's it for today, a little bit more on the professional side. As always, if you like these videos, please keep watching, keep checking in the YouTube channel, and I hope you have a beautiful, wonderful weekend. It is snowing here. We have about 2 inches right now, and it really, truly looks like a winter wonderland, so enjoy the winter wonderland. Have a wonderful day. Bye.